Hi everyone. Today in this video let us discuss Brexpiprazole. What is this medication Brexpiprazole? This drug is one of the antipsychotic just like aripiprazole, and since this drug is a new generation antipsychotic, it is classified as atypical antipsychotic. This drug is available under the brand name Rexulti. Brexpiprazole is one of the atypical antipsychotic which is classified as SDAM. Even this drug affects many of the neurotransmitters. Among them, two neurotransmitters are more important. One is serotonin and second one is dopamine. It is called as SDAM, serotonin dopamine activity modulator. And particularly Brexpiprazole can be used in the treatment of psychotic symptoms like schizophrenia, where it can reduce the symptoms like hallucinations, either auditory or visual hallucinations, which gives wrong perception, and it can also reduce the delusions, wrong judgments. Even it can reduce the social withdrawal in the patients. Thereby, Brexpiprazole can relieve the symptoms of psychosis. This is one clinical indication of this drug. Apart from this, Brexpiprazole can also be used in the treatment of major depressive disorder as an adjunct to therapy. So along with other antidepressant treatment, Brexpiprazole can be used to control the symptoms of depression. But this drug should not be given in the children less than 13 years. So this drug is only indicated in the adults and the children greater than 13 years. These are the two main indications of Brexpiprazole. Recently, this drug found useful in the management of Alzheimer's disease. This is one of the age-related neurodegenerative disorder where there is a significant loss of memory can be observed in the elders. In such people, the loss of memory may be associated with agitation. So in order to control this agitation, again Brexpiprazole can be used in Alzheimer's disease. So these are the three important clinical indications of this drug. So today in this video, we are going to discuss how this drug acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. If you really like this video, please subscribe to our channel and hit the like button to support our work and hit the bell icon to get the notifications on upcoming videos. Now let us start with how this drug acts. Already we have discussed that Brexpiprazole can affect the different types of neurotransmitters. It can bind to the dopamine D2 receptors. It can also bind to the D3 receptors. Similarly, it can bind to 5-HT1A receptors. But all these locations, Brexpiprazole acts as partial agonist. That means it can act as both agonist as well as antagonist at these receptors. Similarly, this drug can block 5-HT2 receptors as well as alpha-1 receptors. At these two locations, it can act as antagonist. So this drug is having multiple mechanisms, but its action on dopamine receptors mainly result in antipsychotic action, but its action on serotonin receptors mainly reduce depressive symptoms. So this is the dopaminergic neuron. On the postsynaptic neurons, dopamine receptors like D2 are expressed. Now normally when calcium can enter into the presynaptic nerve terminal, it can release the dopamine by exocytosis and these D2 receptors are activated. Since D2 receptors are inhibitory in nature, they can reduce the cyclic AMP levels, which increase the dopaminergic transmission, and it can control the various functions within the brain. Now, Brexpiprazole can act as a partial agonist. That means in the lower concentration of dopamine, it can bind to these D2 receptors and it can act as agonist. So it improves the dopaminergic transmission at lower concentration of dopamine. Thereby, it can result in less extrapyramidal side effects compared with typical antipsychotics. But when these dopamine levels are excessively increased in the conditions like psychosis, where D2 receptors are overactivated, in such conditions, again, Brexpiprazole can bind to these D2 receptors, but this time they act as antagonist. They can reduce the dopaminergic transmission, which improves the symptoms of psychosis, resulting in the decreased hallucinations and delusions. It can also reduce the agitation that may be associated with Alzheimer's disease. In this way, Brexpiprazole acts as a partial agonist where it can act as agonist to control the motor symptoms, and it can act as antagonist to reduce the psychotic symptoms. Now let us see the precautions of this drug. One of the important precautions of Brexpiprazole is that this drug can produce orthostatic hypotension since this drug blocks alpha-1 receptor. Because of this orthostatic hypotension during the first few weeks of the treatment, this drug may produce few of the symptoms like syncope, falling sensation, some dizziness, lightheadedness can be observed, and even it can increase the heart rate by reflex action resulting in tachycardia. All these symptoms are observed because of any orthostatic hypotension. So during the early days of treatment with this drug, care should be taken while standing or changing the position because this drug may produce orthostatic hypotension. Another important precaution is that Brexpiprazole is indicated for the treatment of psychosis in the adults as well as in the children. It can also be given to the elders, but where care should be taken because in the elders this drug may produce dementia, loss of memory, and some confused state which may impair the daytime activities. That's why whenever this Brexpiprazole is given to the elders, care should be taken to check any development of significant dementia in the people. If it is developed and if it is untreated with continuous use of Brexpiprazole, it may lead to some cerebrovascular disorders resulting in the increased risk of stroke and death in the patients. That's why in the elders, this drug should be carefully used. Just like other antipsychotics, Brexpiprazole can also produce neuroleptic malignant syndrome. This is one of the rare condition but somewhat serious condition that can be produced by many of the antipsychotics. So this drug may increase the body temperature resulting in hyperthermia. Some unexpected muscle rigidity, muscle spasm can be observed. Along with these symptoms, it can also produce some tachycardia and confusion in the people. Another effect of this drug is that it can produce tardive dyskinesia. This is one of the extrapyramidal side effects that can be observed with many of the antipsychotics. Even Brexpiprazole produce somewhat less extrapyramidal side effects, but still care should be taken when this drug is indicated for long-term use, as this drug may produce some tardive dyskinesia, a slowly developing disturbance in the kinetic movements. Because of this tardive dyskinesia, some involuntary movements can be observed in the people, which are particularly more important in the elder people. Another important precaution is the metabolic changes. With use of Brexpiprazole, metabolic changes can be observed because of its action on serotonin. It can increase the weight and it can also increase the blood glucose levels resulting in hyperglycemia. Since Brexpiprazole acts on CNS, in the people with any previous history of seizures, this drug may increase the seizure tendency, and this is more pronounced when this drug is combined with drugs like opioids, which are further increasing the seizure tendency. So in the people with any previous history of seizure induction, this drug should be carefully used. Similarly, Brexpiprazole can also affect neutropenia, decrease in the neutrophil count, leukopenia, decrease in the leukocytes, which may increase the risk of any infections. And these effects are particularly observed on long-term therapy with Brexpiprazole. Now let us see the side effects of this drug. If we see the common side effects of Brexpiprazole, since this drug acts as partial dopamine receptor agonist, it can produce some motor disturbances resulting in akathisia, restlessness in the people, which is commonly observed with use of this drug. Another common side effect can be observed since this drug acts as a partial agonist on serotonin receptors. Because of serotonin block, this drug can produce some weight gain and increase in the appetite, which is again commonly observed. Other common side effects mainly include headache, constipation, fatigue, and nasopharyngitis can be observed with use of Brexpiprazole. Now let us see the chemical nature of this drug. So this is the structure of Brexpiprazole, and here we can observe a quinoline ring system. Let us give the numbering. This is 1, 2, 3, 4, 5, 6, 7, 8. So this is a quinoline 2-one with saturation at the first position. So 1H quinoline 2-one. At the 7th position, butoxy group is attached. So we can write this as 7-butoxy. So to this butoxy at the 4th carbon, pipergine ring is attached. So we can write this as 4-pipergine 1-aryl. And again to the pipergine at the 4th position, benzothiazepine ring is attached. If we give the numbering to this benzothiazepine, this is 1, this is 2, this is 3, this is 4. So it is attached by 4th position. So 4-1 benzothiazepine 4-aryl. That is a complete name of Brexpiprazole. How it is given? This drug is available as a tablet and it is given once daily. It is available at different strengths starting from 0.25 mg to 4 mg. The dose of the medication depends on the type of clinical indication. For the treatment of schizophrenia, it can be started initially at a low dose such as 1 mg given once daily. But the dose can be slowly increased such that the recommended dose is 2 to 4 mg per day. But in few of the people, the initial dose may be started at 0.5 mg. This low dose is particularly given in the children. For the treatment of major depressive disorder as an adjunct to therapy, it can be started at initial dose of 0.5 to 1 mg. And the dose can be slowly escalated to 2 mg per day, which is the recommended dose for adjunct to therapy. So that's all about this drug, Brexpiprazole, which is an atypical antipsychotic that act as a partial agonist on dopamine D2, D3 receptors as well as 5-HT1A receptors. It also acts as antagonist at 5-HT2 and alpha-1 receptors. Because of partial agonistic activity, this drug is having somewhat less extrapyramidal side effects, so it can be used in the treatment of schizophrenia as well as an adjunct to therapy. It can be used in the treatment of major depressive disorder. And it's also approved to control the agitation in the people with Alzheimer's disease. So that's all about this drug, Brexpiprazole. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.